Greetings, Dr. David Webb, also known as Pain Man MD. Wanted to come to you to talk to you today about an issue that affects a lot of individuals, and that is chronic knee pain. There are various types of causes of knee pain, but one of the most common is what we call osteoarthritis, or chronic inflammatory arthritic pain. There are various stages that take place when someone develops knee pain due to arthritis. The first stage being what we consider minor, second stage mild, the third stage is moderate, and the fourth stage is severe. Osteoarthritis affects three major areas of the knee joint. That is the bones, that is the cartilage, and also the synovium, which is the fluid that lies within the space between the bones and cartilage. Now, during the stages of osteoarthritis, cartilage begins to degrade and eventually narrows. Synovium is the fluid that exists between the cartilage that allows the joints to remain lubricated. Osteoarthritis breaks down the bone, the cartilage, and the synovium. Now, you may ask, how do I know which stage I'm in with arthritis? Well, the first stage being the minor stage, you usually won't know. Individuals or patients who have osteoarthritis won't even notice that they have pain. And even if you get an x-ray, you really won't see any changes. Now, the second stage, which is known as the mild stage, is when individuals start to feel some stiffness in that knee joint. Usually with certain activities like walking and running, when they normally don't have pain, but all of a sudden they do. They usually go and see their physician, and that's when they get an x-ray and start to see some mild narrowing of the joint space. Usually this progresses and then becomes the third stage, where on the x-ray, the cartilage begins to show significant narrowing, and there is usually swelling associated with the knee pain. Most individuals will notice some warmness and swelling after a light jog or run, or when they're doing their normal activities. These signs can all let us know that as a physicians that we need to be a little proactive in trying to help reduce your overall pain. The fourth stage being the very severe stage, that's when there's complete bone loss and narrowing, and usually the synovial fluid has created an inflammatory change, what we call synovitis, and I'll talk more to you about that in a little while. Now let's talk about diagnosis. There are various ways to diagnose chronic knee pain. The first and most important form of diagnosing any type of injury is taking a detailed history. After a detailed history is performed, then a physical exam needs to take place. And with the physical exam, there's usually significant changes noted that lets your clinician or physician know that you have severe or begin to have severe osteoarthritis. And other tests that can be performed include x-rays and MRIs to confirm what we suspect is osteoarthritis of the knee. So let's talk about some of the treatments. In the first stage, which is what we call minor stage, treatment is very minimal. Things can be utilized such as Tylenol or over-the-counter medication, and exercise is usually the most important. One aspect of exercise is trying to not overuse the joint and to start noticing if you are having pain to kind of come to set back or cut back a little bit. I know that's very difficult for a lot of us. Other supplements, which are not FDA approved, but individuals and some physicians recommend include glucosamine and chondroitin. They are supposed to help stimulate and reduce the breakdown of cartilage. In the second stage, which is the mild stage, a lot of individuals may start using what we call NSAIDs, or non-steroidal anti-inflammatory drugs. This is your over-the-counter Advil, ibuprofen, and some medications can be prescribed, such as meloxicam. Now, Other things that can be done during the second stage is physical therapy. I think overall, in my recommendation, that physical therapy has the strongest evidence out of anything we do, from the I like to say PT in the beginning stands for pain and torture. However, it does provide long-term evidence and that it has the best outcomes over a long period of time. So physical therapy is very important, and I'm a big proponent of it. Other things that may be utilized are a knee brace. However, knee braces can only be used for a certain period of time during the day because they can sometimes weaken the muscles if you wear it for too long. Now, the third stage, that being the moderate stage, individuals usually have a lot of pain, and sometimes they may need to see the doctor to get some stronger pain medicine, even including opioids. Other types of treatment include injections with steroids and local anesthetics, which can help reduce pain and hopefully reduce the need for having discomfort and affecting the overall quality of life. And the fourth stage, that being the severe stage, is usually when it's time to consider surgical intervention. Everything can be done to try to prevent getting to the fourth stage. All of these treatments are instituted to help you reduce the progression of the disease. But unfortunately, arthritis is chronic and will progress. It just depends on how quickly and how severe that progression takes place. Other treatments that are new on the horizon include Synvisc, or also known as hyaluronic acid. It's a medication that we call the rooster beak that actually can help lubricate the joint space. Individuals usually have to get a couple of injections, but there's some good evidence to support use of hyaluronic acid. And the most up-to-date use and treatment that is given all of us physicians raves and reviews is the use of PRP, or platelet-rich plasma, which is using the body's own and anti-inflammatory mediators to help reduce pain. If you are dealing with chronic knee pain, the first thing I would like for you to do is to reach out, call my office at 678-383-7246, and let's sit down and have a conversation. There's no reason you should be dealing with significant knee pain affecting your quality of life and affecting you from being happy. Another way you can get in contact with our office or my staff is www.gapainandspine.com. And as always, we're here with the fight with you. One mission, one goal, pain-free.